Hello, I'm Dr. Cathy Gleeson. I work at St Catherine's Hospice on the inpatient unit. I just thought I might share with you a few reflections of how we're getting on. I suppose the main things are, I was asked really how COVID has impacted on the care we offer at the hospice. And initially I thought about how difficult it is to work from behind a mask, covered in plastic aprons and gloves. The fact that it's quieter because we haven't got so many people actually working at the hospice at the moment, they're mainly at home. And the fact that there's not such a hustle and bustle. There's usually lots of visitors coming and going, complementary therapists, visitors, pat dog, all that sort of thing. And we've had to cut back. But then I thought, actually that sounds a bit negative, because in so many ways what we do has stayed the same. We're still admitting people from home at times when they really need help and care support. We're allowing visitors, albeit gowned up. And in terms of what I do and what the nurses do, really our role is the same. We're still there to listen, to try and sort out problems, to do the best we can as doctors and nurses to support people when they need us. And if I think about the concerns that patients have, really they're very similar. Sadly, COVID has added a complicating dimension in terms of more worries and more tests. But really the important things in terms of someone being comfortable, feeling secure, looked after, and working out how we can continue to support them and their family to the best we can, that all stays the same. And so even if I feel strange at times talking from behind a mask and worrying whether people can hear me and realise that I'm doing my best to be empathic and caring, I know that they do feel that because they tell me. And that I find hugely reassuring, and I hope you do too. We still want to do the best we can to make life as good as it can be for those who have limited time. And it's only really through the support and generous donations of all of you out there that we can still manage that. So I'm hugely grateful that you support us to support others. And I think that's a much nicer message to take away.